Thank you, Mr. Chairman, for this hearing today. Thanks to all the witnesses. This is a disturbing issue of ghost networks. I want to ask, though, that there's a bill that Senator Cortez Masto and I have introduced, and Dr. Trustman, you happen to mention this in your written testimony, the Complete Care Act. I know the nature of practicing medicine has evolved a lot, probably during your professional career, both yours and Dr. Resnick's. But one of the things that seems to make a lot of sense to me is we now are embracing the whole person and not just dealing with physical health, but mental health too, to find ways to integrate mental health into physician practices. Could you share more about how you think the bill might be able to help, Dr. Trustman?
Absolutely, and thank you so much for your work on this. You know, as I understand the bill, the opportunity is with the partnership between primary care and psychiatry. The challenge that we've seen over the years, and I worked closely with our colleagues who developed the collaborative care model at the University of Washington. I've worked with people around the country, and I've tried to implement the collaborative care model in my own health system. It's challenging, and frankly, the challenge isn't so much on the side of psychiatry. The challenge is on the side of primary care. It's hard to change workflows. It's hard to have an integration and support system. So I think that the complete proposal that you and Senator, forgive me.
Cortez Masto.
Cortez Masto have developed is critical because it front loads reimbursement and support for primary care to make this real for the first few years. That's central and a wonderful opportunity.
Well, we look forward to working with you and others on that. I know the chairman and ranking member have talked about things that the Congress has done recently in the mental health area, and certainly I agree with them that the status quo is completely unacceptable. We've failed to provide that mental health safety net. But one of the things that I would just draw your attention to or refresh your memory on is we passed the Bipartisan Safer Communities Act last year. It was Senator Tillis and I were involved in hot and heavy negotiations with Senator Sinema and Senator Murphy on this after the terrible shooting in Uvalde. But one of the most overlooked aspects of that, I think, happens to be one of the most important aspects of it. That is expanding the certified community behavioral health clinics and the funding for that. As you know, there had been a pilot program. Senator Stabenow and Senator Blunt had been taking the leadership on that for many years, and I congratulate them for that. They've really led the way. But we made, I think, the single largest investment in mental health delivery in American history, which is incredible and great. But here's the challenge. Dr. Resnick, where are we going to find the workforce? Where are we going to find the trained physicians, psychologists, counselors, and the like?
It's a great question, and I'm glad you brought it up, Senator. As you all probably know, and we've talked with all of you about over the years, and many of you have led in this area, we have a graduate medical education crisis in the United States as well, and psychiatry is a part of it, but it's really across all specialties where we are now seeing shortages. Patients are facing long wait times. I think about this in a few ways. So there's the front end, as you mentioned, training more physicians and non-physician clinicians and nurses, et cetera. We need more GME dollars. We need support for that big bill that will help to accomplish that. Training physicians does take a while. We need immigration reform and additional resources for the Conrad 30 program to help to grow that as well. That provides critical physician access in cities around the country. I also think about workforce at sort of the tail end of the pipeline. I'm worried because as I look at my colleagues around the country, these soaring rates of burnout the last few years, and we know all the things that contribute to that. But if we continue to have health plans adding burdens to physicians, whether it's prior auth, whether it's inaccurate directories, We've got 1 in 5 physicians telling us that they're likely to retire in the next 2 years. So we could acutely lose a lot of that workforce too. So it's important that we think both about the sort of training end and about getting those obstacles and burdens out of the way so we retain the workforce we have.
Thank you. And of course, that applies, as you indicated, not just to physicians, but to allied health care professionals and even school counselors, where part of the problem that we made an investment in safer schools too, because that's where most of the mental health problems, I believe, are likely to be identified and then referred for the kind of care that these kids need in order to get well and not get sicker and sicker and be a danger to themselves and perhaps others. Thank you, Mr. Chairman.
I thank my colleague, and my colleague who spent a lot of time on these mental health issues and with Senator Stabenow has been doing some good work, is making a very important point, and that is we've got a big challenge ahead of us, some serious lifting with respect to workforce, and that's why Senator Crapo and I so appreciated the chance to work with the two of you, Senator Stabenow and yourself, on those workforce issues. And the fact is, in the gun safety bill, the reason we were able to get it in was we had taken the time to write black letter law, and we were ready to go, and the two of you spearheaded the effort. We were going to build on it. I do want to make sure that apropos of my approach to this is I'm going to be all in on these workforce issues, but that is not the same thing as running a ghost network, which is misrepresentation. So we got to deal with both of these issues, and I look forward to working with my colleagues in a bipartisan way on both of these questions.